The big main four non-communicable diseases are diabetes, heart disease, cancer, and chronic respiratory diseases. But these are more or less the NCD endpoints, let me say. You've stated right, 75 to 80% of Pacific deaths is due to NCD. So 8 out of every 10 deaths in an extended family in the Pacific, be assured it's going to be due to one of these diseases. And the rates are alarming. Diabetes, we potentially have the highest rate of diabetes in the world at the moment from one of the countries. 40% and more of people in the 25 to 64-year-olds have diabetes. Cancer, you've actually mentioned. Most of the deaths, if you go to any health system in the Pacific, the leading cause of death is cardiovascular disease. So 75 to 80% of those deaths. If you look at the disability caused by NCD, 1 in every 10 diabetic would have an amputation. Usually begins with a toe amputation, a forefoot, below knee, above knee, gets to the other limb, and that seems to be the progress.
So what our studies have shown is that in the financial costs, they're very different. NCDs are very different to other diseases like diarrhoea and pneumonia and broken arms. Why? Because the costs, even though they're sometimes small, are continuous. So for example, in Vanuatu, blood glucose testing strips, the little things that you should use if you're becoming diabetes every day, costs only 43 cents per strip. Not very much. But that's $164 in the course of a year. That's more than the government is actually spending totally on health care per person. So over a 10-year period, you can see that that's really going to build up. In the case of Samoa, I looked at the cost of treating diabetes patients, it's $38,000 per patient per year, $38,000 per patient per year. That's 12 times the average national income. And 2/3 of those patients have died within 2 years. So you can imagine if you've got 10 patients in the dialysis ward, there's $380,000. The question that the governments are going to have to ask themselves is, would that money be better spent in terms of investing in other forms of healthcare which are needed, in other sectors, etc., etc.? And are these costs growing so much that they're actually threatening your economic financial viability? In Samoa, to their credit, health expenditure is the second highest item of expenditure after education. That's a good thing. That's a good thing. But if the costs of NCDs, which we've said before, are preventable, then you're really going to squeeze out your capacity to fund other things.
One point I'd like to just mention, because I think it's important, is relativities of resources. Because when we talk about approaches by governments, we sometimes forget the reality on the ground. Why is it that things are not moving? Take Solomon Islands, third largest country in the Pacific, population-wise, 600,000 people. They've got one NCD doctor, one coordinator, and a few nurses for 600,000 people. The recent Solomon Island budget that was passed by Parliament, or still being debated, is 3.2 billion Solomon dollars. For Solomons, that's a record. Translate that into Australian dollars, 600,000. The whole Solomon Island budget is smaller than the 6 months budget of the Royal Brisbane Hospital. And I think when we start to have a look at some of these realities on the ground and ask the question, why are things not working? We need to spare a thought that in many of these countries, there's probably 1, 2, 3 people trying to organize a system for the whole of the population. And sometimes it's very easy for us to make judgmental things of this country's not doing this. Look at Tuvalu, they probably have 1 person looking after all of that for 9,000 people. So I think it's very important as we look at solutions that we don't distance ourselves from the realities of the ground in these countries. The Pacific is 4 times the size of China in terms of area. That's quite important. And therefore, logistics, communication, transportation cost is the highest anywhere in the world.
I wouldn't call it a nanny state. I mean, The people who say that don't really mind then when they turn up at the hospitals expecting nanny, that is the government, to pay for all of their healthcare costs. So I reject the idea that it's necessarily a nanny state. I think what governments have got to do, I agree that they've got to raise taxes on tobacco. Not just that, I think people have got to actually implement the controls and the regulations that they've implemented. Tonga did a very clever thing, which was to survey the degree to which their rules on tobacco are actually being implemented. 2/3 of the trade stores in Tonga were still selling cigarettes by the single stick. That can be stopped by investing a little bit in those sort of issues. In terms of the taxes, prices do affect behaviour, but there's going to be limits on how far people are going to change behaviour. Changing behaviour on things like obesity, et cetera, is very hard, and so taxes are going to be helpful. It's not the only thing.
What legacy does the current generation of decision makers leave behind for future generations? And I think the whole issue there becomes one of history. Shows, I think it's Thomas McEwen from Australia, that actually in a book that he wrote, that the 6 things that have made great contribution to health were education, water, sanitation, nutrition, housing, and environment. And pour money into those, health looks after itself. And I think much of history has also looked at that. If we were to look at the 10 things that have made the huge impact on health of late, I think the CDC, only 2 or 3 of those were health. Most of them were outside of health. And I think it's very important that we don't lose sight of the fact, as we look at in-health solutions, that much of what we're looking at is probably outside of health, therefore the need to generate support from outside of the governments. And I think it's very important that we focus on children, because they're the up and coming. And invest as much as we can in changing the behaviors of existing adults, because I'd rather we leave behind an epitaph, here lies the person that invested in the future of the children, than an epitaph that says, here lies the person that drank himself to death.